The president said he didn't trust us. In so many words, he basically said that if they weren't doing this, people wouldn't get the health care they needed. Literally said people would be dying in the streets. And that's the problem. This president, time and time again, doesn't believe in federalism, doesn't believe in the 10th Amendment. He truly believes the federal government knows best.
My one-time congressional colleague, now the governor of Louisiana, Bobby Jindal, explaining why he refused to take Obamacare money to expand Medicaid in Louisiana. Welcome back to America's Forum. Obamacare's offer of Medicaid expansion, one of the few parts of the new health care law that won some Republican governors over, at least in terms of implementation. Now, here's how the deal is supposed to work. If states decide to expand Medicaid, the feds will pay 100% of those costs for the first 3 years, then 90% afterwards. Now, that's mighty tempting. And a lot of Republican governors took the bait. But according to our next guest, Washington is making promises it cannot afford to keep. Let's go in depth now for this analysis as we're joined from Naples, Florida by Tarren, the CEO of the Foundation for Governmental Accountability, and also with us from our Newsmax TV newsroom, Newsmax Deputy Health Editor Nick Tate. Nick is a busy guy. You know he is the co-author of Da Vinci's Baby Boomer Survival Guide. So, Tarren, why is Washington making promises it can't keep, and is there a historical record of that evidence?
There is a record of that, and that's what Washington does again and again, and it's only the states that seem to fall for it. This is just like Charlie Brown trying to kick the football and Lucy taking it away again and again. Washington makes a promise, and then Washington breaks a promise, and it's the taxpayer that's left holding the bag.
Well, mindful of that, what's really going to come up down the pike here? Because, I mean, Paul Ryan has said that federal funding for Medicaid expansion is going to be eliminated. If he's saying that in Washington, D.C., why would Republican governors say, oh, okay, we're going to trust the administration and the money's going to show up anyway?
Well, I think this is a great example where you have governors who are really believing in hope over experience. And it's not just Paul Ryan. The budget resolutions passed by the Republican House and the Republican Senate both repeal this money. And even President Obama took money, reduced the funding formula 2 budgets ago of his signature healthcare law. So when you have Democrats and Republicans in Washington saying this money's going away, states shouldn't be surprised at all, and they shouldn't fall for this false promise of Obamacare's Medicaid expansion funding.
Now, Nick Tate, you, of course, in addition to the Baby Boomer Survival Guide, you wrote the Obamacare Survival Guide. I'm wondering, did you realize you would have to put some governors in there as well? I mean, if you were writing a chapter to Republican governors about this disappearing money, what might it say?
Well, it might be a warning to, caveat emptor, be careful here. The truth is that many states have responded to this mandate by saying they're not going to do it. They are going to try more creative ways to hold down costs on Medicaid. Arkansas, for instance, has gone to more of a privatized Medicaid plan, yet still receives federal funding. In states like Florida and Ohio, they're experimenting with Medicaid HMOs, and they're looking at ways to charge maybe small copays to Medicaid recipients and tying that Medicaid benefit to employment. Tarren, my question to you is, well, how do we solve this mess if, in fact, we should not be trusting the government to come through here because we're looking at an $18 trillion national debt, and the likelihood that Medicaid funding is going to come down? Should we be turning it over to states to more creative solutions here? What do you see as a prospect for solving this problem?
Well, I think absolutely we should be turning it over to the states, but I think we should be fundamentally looking at how do we free Americans from poverty, not how do we lock them in poverty by expanding Medicaid welfare and punishing them if they pull themselves out of poverty. We should be talking about how do we have work requirements so individuals who are in poverty today can work full-time and get out of poverty. Only 3% of folks who work full-time are in poverty. So we shouldn't be expanding welfare. We should be expanding opportunity and helping Americans and their children climb out of poverty.
Well, Tarren, we always appreciate the aspirations and the goals in mind, but of course, trying to get that done in Washington, you deal with a lot of people who give you a lot of static. I remember we were doing Medicare reform. That was part and parcel of the thing with the hospitals. And now there's talk from healthcare professionals dealing with hospitals about the effect of Medicaid expansions or the lack thereof. Let's listen to what Caroline Pearson, Senior Vice President of Avalara Health, had to say, and then let's get your reaction after we listen to it.
When the law passed and the hospitals sort of signed on for these cuts, Medicaid expansion was expected to be mandatory in every state. Of course, that changed when the Supreme Court made Medicaid expansion optional, and the hospitals are really the ones that have been caught in the crosshairs of that decision.
Now, notwithstanding the fact that hospital administrators are always squawking about what goes on with health care, is there some legitimacy to her evaluation?
No, not at all. In fact, if you look at states that expanded Medicaid before Obamacare, hospitals were in a worse financial position than before those states expanded. Maine and Arizona are the poster states for this, where hospitals lost more money. Because the fact is, when somebody goes on Medicaid, they use the hospital more, and the hospital loses money on every Medicaid patient. So if you're losing money on every Medicaid patient, you're not going to make it up on volume.
But Tarren, the problem is that many hospitals were getting either tax benefits or they were getting extra funding from state or federal government coffers to make up the difference for those millions of Americans who are very poor who seek treatment at the ER, at the hospital. The idea was that Medicaid would somehow magically fix that. That's not happening. What should be happening to make up that difference? Because without a solution, we're going to pay higher taxes, we're going to pay more in healthcare costs and more in healthcare premiums, and that's part of the reason they're continuing to go up. What's the solution here?
And Tarren, about a minute for your reply here, sir.
I think the solution is you want to get individuals into private insurance, and you want to recognize the fact that when somebody goes on Medicaid, they actually use the hospital service more. Oregon had the famous Oregon Health experiment, and people on Medicaid used the hospital 40% more than individuals who are uninsured. That's why it's a loser for hospitals to expand Medicaid welfare.
Tarren Bragdon, we do appreciate the fact that you are offering this cautionary tale of how Washington promises one thing, federal dollars, and then fails to deliver it. Nick Tate, as always, we appreciate your many contributions, not only the Medicare Survival Guide, but your new book as your co-author of Da Vinci's Baby Boomers Survival Guide. For more on this book, go to the website babyboomers711.com. That's babyboomers711.com. And America's Forum continues following this update.